Hi, Assalamualaikum. So now I'm going to share with you what would be the differences between breastfeeding and exclusive pumping. Okay, so you may think that exclusive pumping and breastfeeding would be the same benefit to the baby, right? Because you're still giving breast milk to the baby. But in fact, there are also other added benefits that you may or may not be aware of. Okay, so number one, if you're exclusively pumping and you're giving the baby EBM, then the baby is getting less immune system benefits compared to babies who are being breastfed directly. So why is that? So it's because when you express your breast milk and you store the milk in the refrigerator, or when you feel they want to freeze the breast milk, after a while the immune factors in the breast milk will become lesser. And and studies have shown that babies who are fed with expressed breast milk, they have higher risk of wheezing later compared to those who are directly breastfed, right? And you know that babies who are directly breastfeeding, they have there's this exchange of good and bad germs, right, in between the baby and the mother, and the mother's so-called microbiota will be transferred to the baby, or the good germs will be transferred to the baby. So when the baby is not directly latching to the mother, these things don't happen, and it will also affect the baby's immunity. Okay, so difference number two is there will be a higher risk of contamination, because when you are expressing the breast milk, you're using a breast pump, and the breast pump itself, as you know, has got a lot of parts, right? The flange, the tubes, and then you have the milk collection bottle. So even if, let's say, you're sterilizing all those equipments well and you're cleaning it well, there'll be those small little parts that's like very difficult to clean. So that would be a risk of contamination there as well. So third difference would be there will be a higher risk of milk supply issues, meaning in the long run your milk supply will become lesser and lesser and lesser. Why is that so? It's because most of the time when you are pumping the milk exclusively, you tend to miss the night feeds, right? Because you know, when you pump, you're supposed to pump during the day and even at night as well. Why at night? Is because at night is when the prolactin level is at its high. Okay, so when you pump during that time, or you feed during that time, that is how we will make sure that you have a constant good flow, a constant supply of breast milk. So when you're pumping, you tend to miss that, and after a while your supply will be diminished. Okay, and it is said that compared to direct breastfeeding, exclusively pumping, you tend to stop breastfeeding earlier compared to those who nurse the baby directly. Okay, number four is there will be a risk of overfeeding, because if, let's say, you're feeding the baby using a bottle, using the teat, you know, the teat, it's got this rapid, just like constant flow. The baby doesn't really need to suck actively to get the milk out compared to directly latching. So even when you're giving the baby whichever amount, baby will tend to just swallow whatever you're giving until the baby vomits lah, right? So there will be a risk of overfeeding there compared to breastfeeding, when they just doze off or they just let go of the breast when they're full. Okay, so when there's a risk of overfeeding, there will be rapid weight gain, and in fact there is a higher risk of obesity compared to those who are breastfed directly. Okay, other reasons would be there will be a difference in the breast milk content. For example, if you know that breast milk is very dynamic, right? It changes, the content changes throughout the day depending on what the baby needs, right? And let's say when you're exclusively pumping and you're not pumping long enough, then you will not get the hind milk, and the hind milk is the one that has a high fats. So the high fat is the one that contains the DHA, and you know that DHA is good for the brain. So when lesser fat, lesser DHA, and it will also might affect the baby's brain development. And yeah, so meaning that the baby will not get whatever that the baby needs during that time, because when you pump, it doesn't mean that the baby is going to get the milk directly at that time, right? Okay, so these are some of the differences. There are many more, but I thought just sharing these 5. And please don't get me wrong, I salute you for breastfeeding or exclusively pumping, right? So that's great. But if, let's say, you are exclusively pumping for personal reasons, so try to at least direct feed your baby in between if possible, so that you do get some of these added benefits. All right, so with that, bye.